Hello and welcome to this podcast in which we will describe the black and brown rule for differentiating congenital nevi showing a globular pattern from schizoid melanocytic neoplasms showing a globular pattern. A short disclaimer: the content of this podcast is based on personal observations which have not yet been formally studied. The dermoscopic diagnosis of a given melanocytic lesion relies on the assessment of three main criteria: colors, which allow us estimations about the location of melanin in different levels of the skin; morphological patterns that allow us to identify different types of melanocytic tumors; and distribution of colors and patterns that allow us to differentiate between surely benign nevi from virtually potentially malignant skin tumors. If we look at the colors of melanocytic neoplasms, they are mainly due to melanin in different levels of the skin. Melanin in the stratum corneum gives rise to black color, whereas melanin at the dermoepidermal junction will appear brown. Melanin in the papillary dermis will appear as brown or gray color, whereas melanin in the reticular dermis appears blue. A globular pattern is the hallmark of small congenital nevi, but can be sometimes seen also in schizoid neoplasms, including spitz nevus and melanoma. The question is how to differentiate now a congenital nevus from a spitz nevus or melanoma showing a globular pattern. Here we have to look at the histopathologic differences between congenital nevi and schizoid neoplasms. In congenital nevi that show a globular pattern, we will find variable large nests of melanocytes, mainly in the upper dermis and at the dermoepidermal junction, but not in the stratum corneum. Instead, in schizoid neoplasms, we also find variable large nests in the upper dermis at the dermoepidermal junction, but additionally we can find pagetoid spreading nests, so melanin, in the stratum corneum. Accordingly, we can see in small congenital nevi usually brown to brown gray globules, but we will never see black globules. Instead, if we see brown-gray globules, but in addition also black globules, then we should think about the possibility of a schizoid neoplasm. Some more examples. This is a congenital nevus that shows brown to brown-gray regular globules. Instead, in the spitz nevus, we can also see brown and gray globules, but additionally we can see black globules. Another example of a congenital nevus showing brown to brown-gray globules. In this case of melanoma, we also see brown globules, but again additionally we can see the presence of black globules. So to summarize, the black and brown rule, or BB rule, is a simple clue to differentiate between small congenital nevi and schizoid neoplasms showing a globular pattern, whereby congenital nevi are BB negative, whereas schizoid neoplasms are BB positive.